Hi, I am Dr. Robbie George. I'm the head of vascular surgery at the Narayana Health City in Bangalore. And the purpose of actually using this DVT Awareness Month is to highlight what is a DVT. You see, a DVT is a deep vein thrombosis. That is, a thrombus is a blood clot that forms typically in the deep veins, and the deep veins of which territory? Most commonly in the leg. So either in the calf of the leg or the thighs, or sometimes even in the lower part of the abdomen. Now, why do we want people to have awareness of it? Because DVT, which is the common short form used for this, is a major silent killer, which unfortunately often gets underdiagnosed and underdetected, and in some patients can actually result in even death. There are smaller degrees of complications also when patients get what is called pulmonary embolism or they get what is called post-thrombotic syndrome. But DVT has the potential to be a very dangerous disease, and it is one of the leading causes of death in certain patient subgroups. Now, why does a DVT develop? So, a DVT develops basically when there is a blood clot that forms due to a variety of risk factors. Now, the significant risk factors is if you've had recent surgery, if you had a recent very long flight, if you're dehydrated, you've done a long travel, or if you've got a family history of forming blood clots, women who had a recent delivery, who had a cesarean section, women who are pregnant are also at increased risk. Anybody who has been on oral contraceptive pills, the risk increases slightly. So there are risk factors, but these are often a combination of things which trigger that. So if you think you have potentially, you could be at risk due to some of the risk factors that I mentioned here, a DVT is something that I'm sure your doctor would be trying to take care of and prevent. So what can you do to prevent DVT? One of the most important things is to avoid getting dehydrated. So if you are having a stomach upset or vomiting, make sure you stay well hydrated. Whenever you're traveling, make sure you stay well hydrated. Avoid prolonged periods of immobility. So get up and walk if you're on a long flight. Make sure you drink fluids while you're on a long flight or a long journey. If you have any health condition or a family history of DVT, make sure your physician knows about that when they are involved in your care. It helps us to decide what is suitable and not suitable for you. It is also helpful to avoid the other general risk factors. So being overweight, being sedentary, excessive alcohol intake, excessive tobacco intake, all of these also increase your risk of a DVT. Now, as a patient, when should you get concerned that do I have a DVT? Is this something that needs to get checked out and treated? So the commonest site, like I said, is in the leg. So if you get a painful, swollen leg, especially if it's on one side, that is something that requires an evaluation. That's a very simple rule of thumb. So if you've got pain in the leg, any swelling, any patches of localized redness, discomfort, go and see a doctor. And how would we make a diagnosis of DVT? One of the best tests for this is to get a simple scan, which is an ultrasound scan of the leg, which helps us to look for the blood clot. Now, if you have a DVT, it's not the end of the world. It is very much a treatable condition. And the reason we do this DVT patient awareness is so that we pick it up early and we can start the appropriate treatment. Because if you start the appropriate treatment, you dramatically reduce the risks of complications and longer term problems. And treatment typically is going to be to put you onto some blood thinners, might be injections and a combination of tablets, which will go on for some months. The duration varies depending upon the kind of clot you've had and what we think is the reason. But taking the right kind of blood thinners, the right kind of treatment can really, really keep you much safer from avoiding complications from a DVT. And for those of you who have had a DVT in the past, there are certain subgroups where we will stop medications where it is appropriate to do that because the risks of a recurrent or a repeat DVT are small. But there are certain other subgroups which we feel that the risk of having a further DVT again is very high. And in those subgroups, we would really want to assess how long we need to continue your blood thinners and at what dose. So DVT is a disease or a condition which is best prevented, suspected early, treated properly, and then it becomes very manageable. So keep this in mind for yourself or any near or dear ones who might be at risk. Thank you and take care.